We reopened our offices on May 26, 2020 for after the COVID crisis, and opened up our full offices really on June 1st when I was doing surgeries the week before. This podcast is really talking about the safety measures that we have instituted to make sure we're safe. We actually legally could have opened up in early May, but decided to wait about 3 weeks extra before we opened up, simply to make sure that everything was in place, policies, procedures. I don't want to go through every single policy procedure here because it will probably take me half an hour to an hour, but some of the salient things that you need to know about safety is that we recently just expanded. In fact, June 1st, we opened up a huge expansion that tripled my space. So patients must be asked to have a mask when they come in. If not, we provide a mask for you at $5. And then you are brought directly to the room. And in that room, the door is closed. We actually have a UV and HEPA filter that completely cleans the air in the room every 15 minutes. So the goal is that at maximal capacity, patients are actually using a room no more frequently than twice in an hour. So there's a double cleanup of each room in the air. Oftentimes it's actually 3 to 4 times cleaned up in that single room before another patient walks in. Of course, every surface is disinfected using hospital-grade materials. And I, of course, am protected from you using medical-grade respirator devices to minimize vector transmission between patients. I always tell my patients that, some of my patients are thinking this is a hoax, it's not a big deal. Some people take it very seriously. I take it very seriously. And at least I don't mind if you don't believe this is real. I don't mind if you don't believe the COVID issue is a big deal. But when you're in my office, in order to be safe, I take it at the highest level. And because I can be a vector of transmission between patients, my staff and I are wearing either N95 or P100 respirators to protect us throughout the entire day. In fact, I have lunch in my car. So I'm not even there in presence with my other staff. I don't want my staff to infect each other. So all of us are protected from each other and protected from you, and therefore you're protected from us. So these measures are pretty stringent. I could go into far greater detail, but I just wanted to let you know that safety is a huge concern to us, for you as well as for us as staff and as the owner of Land Facial Plastics and the provider.